Again, introduce myself. This is Candace Kinker. I am with Coconino Health and Human Services and Northern Arizona Alzheimer Dementia Alliance. And thank you everyone for joining us today for Medicare and Memory Care. Ryan, I will keep an eye on the chat and the waiting room, and we will do questions at the end. So thank you everyone, and I will turn it over to Ryan.
Awesome. Thank you so much, Candace. Appreciate that. I'm going to share my screen here with everybody, so give me just a minute to get that going. All right, that is coming. There we go. So let me get to the beginning here. All right, so everybody should be looking at the screen that says Medicare and Memory Care, what you need to know about Alzheimer's and dementia. Does everybody see that? All right. So today, before I introduce myself, kind of talk about what we're going to cover on this webinar. First, we're going to kind of understand Medicare coverage for Alzheimer's dementia. Then we're going to learn a little bit of how original Medicare versus Medicare Advantage paths impact Alzheimer's dementia. And then lastly, we're going to discover the new guide model and how it can assist and help. So that's kind of what we're going to go over here today. Some of you may know who I am. I know there's a lot of you on the call. Some of you may not. And I realize some of you may know a whole lot about Alzheimer's dementia and Medicare, and some of you may know nothing about it. So if some of this is redundant, I apologize in advance. But really briefly, my name is Ryan Steinert. This is my wife, 6 kiddos over here, and a son-in-law. Yes, you heard right, 6 kids, all from the same woman too, ironically. And over here is my brother, Rob, who works with me full-time in my business. I own a company called Your Medicare Helper. And where I learned all this Medicare stuff, I used to be a Medicare biller for 3 skilled nursing facilities right here in the Verde Valley. So the one in Cottonwood, which is where I'm located, Camp Verde, Sedona, room and board meds therapies was about 500 people a month. And I did all that Medicare billing for 7 years. So I learned a lot about how Medicare works and doesn't work. And it was really that experience, all of the confusion, questions, misinformation about Medicare. I decided to open up my own insurance company about a decade ago now. Yes, sell the Medicare products, but really educate people on all of this Medicare stuff. I try to give everybody the I didn't know that, nobody told me's, because there's a lot of those when it comes to Medicare. So I'm a broker. I do not work for any company. I represent multiple companies, carriers, and products. I'm in about 22 states doing Medicare. If you want to Google my company, Your Medicare Helper, please do. We recently hit over 650 5-star reviews for my agency. So we've got some fans out there. So that's a little bit about me, a little bit about us. And so now we'll kind of jump into this Medicare and Alzheimer's dementia stuff. I think the first thing I'm going to do really quickly is just some general education on these 2 Medicare options, because that'll tie into how they impact and affect Alzheimer's and dementia. So anybody on Medicare, you kind of have 2 different roads, 2 different paths, 2 different options, and you have to pick one. You either stick with original Medicare A and B, which covers 80% of Medicare approved charges. This is through the government. The government's managing your Medicare benefit. You can add a supplement or gap plan to that if you want to cover some or part or almost all of the remaining 20%. You can add a Part D for drugs, prescription drug plan. So this is one route, one option, or you get what's called a Medicare Advantage plan. Medicare Advantage plans are also called Medicare Part C. You know, we like to call things 2 or 3 things to keep it complicated and confusing for you. But if you hear the term Medicare Advantage or Medicare Part C, it means exactly the same thing. There are some key differences and nuances, pros and cons between these 2 options. So I want to briefly, in an overview, touch on that. When you have original Medicare and a supplement plan, again, the government's managing your Medicare benefit. Uncle Sam is in charge. There is no network on this path. So it's not an HMO, it's not a PPO. You can literally see any provider in the United States of America that accepts original Medicare. Okay, no network. There are different supplement plans you can purchase. With the most exhaustive plan available, your maximum out-of-pocket in a calendar year could be as low as the Medicare Part B deductible, which this year is $257 for the year, meaning you pay that deductible, you are covered for Medicare approved charges after that. The con of this path is that it is much more costly on a monthly basis, typically, than Medicare Advantage plans. So you're going to pay more per month on this path, but you're going to have the least out-of-pocket costs on the back end if and when you go to use it. Medicare Advantage plans, on the other hand, the other path over here, you still have Medicare A and B, but the government does not manage your Medicare benefit anymore. Now it is a private insurance company that manages your Medicare benefit. They're in charge. They do have a lot of autonomy, a lot of control. Medicare Advantage plans are all HMOs or PPOs. So it is all about in-network, out-of-network. Does my provider take it? Do they like it? With Advantage plans, they're not 80-20s, 80%, 20%. They don't work like that. With Advantage plans, you pay copays for every service. So a copay to a primary doctor, copay to a specialist, copay for blood work, lab work, hospital stays. You're going to pay these copays until you hit the out-of-pocket maximum on the plan you choose. And that varies. A lot of plans in Arizona might be $4,000, $5,000, $6,000, $7,000 a year, and then they cover you in full. There are definitely more prior authorizations and referrals in the Medicare Advantage world than in the original Medicare world. And you do need to be aware that there are a growing number of providers out there who don't like some Advantage plans or maybe all Advantage plans and do not take them. Mayo Clinic accepts 0 Medicare Advantage plans as an example. So these are kind of the key differences between these two options. And then there's one little catch-22 that I want to mention that's pretty important. So there's no underwriting or qualifying for Medicare Part A and B. There's no underwriting or qualifying for Part D drug plans, and there's very little underwriting or qualifying for Advantage plans. But I do want to go back to the supplement or gap plan to Medicare. Anyone, you are only a guarantee issue for a supplement plan to Medicare, meaning your health does not matter one time in your life. And the rule is when you get Medicare Part B for the first time in life, whenever that is, you have 6 months to obtain whatever supplement plan you want from whomever you want. Nobody asks you any health questions. You are guaranteed to get it. But anytime after that 6 months in Arizona for the rest of your life, if you want a supplement plan, now you have to go through medical underwriting. You have to be approved, and a carrier does not have to accept you. They can just flat out deny you. And a lot of people don't know this, or they don't really understand this. So if you are getting ready to come on to Medicare and you think there could be a possibility of Alzheimer's or dementia coming on in any way, just slight memory loss, whatever the situation may be, you may want to consider going with option 1 out of the gate, because if you don't and you start with Advantage and later in life you develop a diagnosis, it may be very challenging for you to come back to option 1 and obtain a supplement plan. And that's very important for people to understand. Okay, I know we're going to save questions at the end, I believe, so make sure you jot them down or write them down, and we'll address questions at the end. So let's talk a little bit now about how Alzheimer's and dementia kind of affect Medicare. So I want to start off with dementia is considered a chronic condition, a progressive condition, meaning it's not an acute short term, it's a chronic condition. Unfortunately, however, Medicare does cover medical care when it comes to dementia, Alzheimer's, but they do not cover custodial long-term care issues related to the activities of daily living, like toileting, bathing, dressing, meals, supervision, wandering prevention. And there's definitely a common misconception out there that Medicare covers or pays for memory care facilities or long-term care facilities. And Medicare or Medicare Advantage, either path, I'm just talking the umbrella of Medicare now, they do not do that. They do not cover that. And there is a lot of confusion around that. So what does Medicare cover? So let's talk about that for a minute. So you do get an annual cognitive screening with Medicare. You get a full cognitive assessment and a care plan. You are able to have neurology visits, MRIs, PET scans if necessary. Those are covered under Medicare. And medications are covered under Medicare. Again, those could be either Medicare Part B or Part D. And what I mean by that is any medications that get administered to you in a doctor's office, in a clinic, inpatient, outpatient, infusions, injections, that all gets billed to Medicare Part B. Medications you may take at home, that gets billed to your Part D prescription drug plan, whether you have a standalone drug plan with original Medicare or one that's built into an Advantage plan. But common medications like diazepam, galantamine, memantine, in the Alzheimer's dementia world, when you take those at home, those get billed to Medicare Part D, as in drugs. Medicare covers home health only if you are homebound and it is a skilled need. So what is a skilled need? That would be physical therapy, occupational therapy, speech therapy, or if you need certain types of IV medications, those are considered a skilled need and covered under Medicare. Otherwise, not covered. Medicare does cover hospitalization and short-term skilled nursing. You get up to 100 days in a skilled nursing facility. Up to is kind of the key word there, but a maximum of 100 days per benefit period. So what does Medicare not cover? Again, a lot of folks think that assisted living, memory care facilities, long-term care, custodial care facilities are covered, but unfortunately Medicare does not cover any of that. Supervision for dementia, homemaker services, live-in caregivers, adult daycare, not covered under Medicare. So now I want to kind of chat about some major differences between original Medicare, Medicare Advantage for dementia patients. So if you're on the original Medicare path over here, original Medicare really does not coordinate any care for you. They do not assist with any care coordination, whereas some Medicare Advantage plans do have care coordinators, case management, and there can be some assistance and involvement there in that situation. That's a key difference. Original Medicare does not have any prior authorizations involved, where Medicare Advantage plans typically require prior authorization for neurology, the MRIs, the PET scans, behavioral health, any home health needs, skilled nursing. So there are a lot of prior authorizations involved in the Medicare Advantage world. So original Medicare, if you're looking for freedom of providers, fewer challenges, oops, didn't mean to go there. That's going to be the better way to go. But no added dementia support benefits, and typically, again, a higher monthly cost. Medicare Advantage, if you're looking for that care coordination, maybe some extra benefits, maybe lower premiums, that could be the better way to go. But you will have challenges with networks, prior authorization, and behavioral health access. So I want to kind of touch on some legal and financial planning topics. I'm sure a lot of you probably already have this dialed in. This may sound very basic and elemental, but I run into a lot of people that still haven't thought about these things. So if you're entering into any situation where dementia, Alzheimer's might become a diagnosis, might become a concern or an issue, frankly, even if it's not, you really should have a durable power of attorney, and you should have somebody designated to take care of those issues for you. This can help with changing your plans every year, managing prescriptions, signing applications, just making any decisions on that healthcare, having that durable power of attorney, very, very important. It can be virtually impossible to do things in this healthcare world without that. Having your advanced directives in place, very important. And what a lot of people don't know is having a lot of these carriers, a lot of these companies need to have your own representative. So once you have that paperwork, you contact the specific carriers of your plans, and now you can be designated as a representative. You can call, ask questions, make changes, but you do have to do that with each individual carrier. It's not just a broad, I'm going to do that with Medicare. You've got to do that with Medicare. You've got to do that with your Advantage plan. You got to do it with your supplement plan. You want to do it with your Part D drug plan. Any policies that you have, you want to make sure that you have that separate carrier representation. Okay. All right. So want to talk a little bit about CSNPs before we get into really what I'm excited to talk about, which is the guide model. Okay. So what is a CSNP? So a CSNP is what's called a chronic condition special needs plan. So CSNP is the acronym for this. These are in the Medicare Advantage world, and these are specific plans for people with certain chronic conditions. You do get extra benefits with these plans, like care coordination, tailored networks. There's definitely more support with these plans with certain diagnoses. But we have a challenge here in Northern Arizona in 2026. And I'm really talking about 2026 now, because 25 is almost over, which I cannot believe we're there already. But next year, there are only 3 chronic chronic special needs plans in Northern Arizona, in Yavapai, Coconino County. There's only 3 of these plans that are offered to begin with. The challenge we face is this. Although there are 15 diagnoses that the Center for Medicare Services, CMS, broadly states these are chronic conditions, and dementia is one of those federally, it's actually up to the individual plans locally to determine and recognize what chronic conditions they feel fall into that. And dementia is not listed as a chronic condition next year on these 3 plans that are available in Yavapai, Coconino County. I don't know why that is. It's probably money at the end of the day somewhere. They should be, but they are not. And I don't mean to be the bearer of bad news on this call, but I've done as much research and homework as I can on this, and it's not listed there. So that is a bummer. I hope that will change, and those plans will add this condition, because there is some nice benefits with that. But I do have some good news, finally. And the good news that I want to talk about today is I really want to introduce what's called the guide model here in Northern Arizona. And I really want to thank Sonia Soto, who I believe is, I think I saw her log into this somewhere on this webinar. So I believe she's on here, but I really want to thank her for providing this information and making me aware of this program, because I didn't know about this program. So what this guide stands for Guiding and Improved Dementia Experience, right? Guiding and Improved Dementia Experience. That's what the guide model is. So what is this guide model? Well, it's a federal program that just came out, really, I think this year or maybe 2024, but really in this year in 25, there are only 7, I think, No, no, that's not it. I think there's not very many providers in Arizona at all that are offering this program, but Dignity Health, in partnership with the Cunningham Center, is offering this program. And they started this in July. And this is a program to assist and help those with dementia. So I kind of want to look over here if you can see this. There's 9 different delivery services provided. There's a comprehensive assessment, person-centered care plan, 24/7 helpline access, ongoing support, care coordination, referral, coordination of services support, medication management, recommendation, caregiver education, and respite services for those who meet Medicare qualifications in this. And so who will qualify for this program? Coming over here. So you obviously have to have a diagnosis of dementia to qualify. Here's where things get a little murky. You must have traditional Medicare A and B as a primary insurance. What that means is original Medicare A and B, not the Medicare Advantage path. That's everything that I'm reading and I'm seeing is it's got to be traditional Medicare A and B only. You've got to reside within the service area zip code, cannot be on hospice, cannot be in a long-term care facility. So this is meant to help those that are at home and especially those who need or can use some respite services. And according to the information I was given by Sonia, persons living with dementia at the moderate or high level of complexity, they're eligible for $2,563 in respite care and help. So this is a brand new program. Again, here in Northern Arizona, Dignity Health is the only, hospital, only clinic really in Northern Arizona that's providing this. But fantastic opportunity for a lot of you out there to learn more about it. I've got Sonia's contact information over here. Hopefully she's okay with me throwing that out there because I've done it now and I can't take it back. So I know that was fairly quick. What am I, barely 30 minutes? I kind of ran through that. But that's really the information I wanted to share. I kind of really wanted to see what questions, conversation. Sonia, if you're on here, if there's anything else you want to add about the guide model, please jump in, correct me, edit me, help me out.
Ryan, this is Sonia. I don't know. Can you see me? I'm probably on the
I can.
wrong screen. Anyway, yeah, you did a great job there summarizing a brand new program, and it did start across the country last year in July of 24. But you're right, our program started July of this year, and one thing I just wanted to add to complement what you already shared there is that $2,563 is for this fiscal year. So once they qualify, they have that number of dollars to use through any of our partner organizations that provide respite services until June 30th of 26. And then July 1 of 26, a new allotment would be granted for anyone who meets the moderate or high level of complexity, which is determined by Medicare based on our assessment. The program here is really doing great. We're currently aligned to 69 families in the Prescott Valley, Dewey, Chino Valley area. I will say one update. You're correct in that there are only 8 guide model clinics in the state of Arizona. We are the only clinic in Northern Arizona. There are some completely remote guide model programs that stretch their service area beyond what we serve because our program is very much in person, and theirs is somewhat tablet-based and virtual. So there are some other guide model programs that are actually serving Medicare beneficiaries across the country, but they're doing it through a virtual program and use of vendors that are in the local communities. So if there are folks in Sedona or Cottonwood or Verde Valley, that's beyond our service area, but there are some virtual programs that can help them. And I'm happy to talk with anybody who might benefit from that information.
Awesome. Wow, that's fantastic. Yeah. I mean, sounds like a great initiative. I know it's in that pilot stage. I hope it continues to grow and has success and can continue to expand, to other areas. But no, this is great. Does anybody out there have questions for me or for Sonia about the guide model?